We're ready. Hi, this is Savada Tilly, and again, welcome to My Sister's Keeper Cleveland. We are so excited about today's program, and we do always appreciate your support for us. Again, this is My Sister's Keeper Cleveland Sister Circle. I know that we've been on a little hiatus, but we're going to get back to programming, and our first program is actually being brought to us by the National Kidney Foundation in partnership with Chi Phi Sorority Incorporated. So again, without further ado, I'm going to introduce Daphne McCaleb, who is the Vice President of New Chi Chapter of Chi Phi Sorority Incorporated.
Good evening, everyone. As Lavada Tilly just said, my name is Daphne McCaleb. I'm the Vice President of Chi Phi New Chi Chapter. Chi Phi is a national sorority, nursing sorority, I'm sorry. And we've been around since 1932, but we've been serving the greater Cleveland community since 1966. And one of our focuses is always to get information out to the community. And so we are partnering locally with My Sister's Keeper and then with the national partner, the National Kidney Foundation. So we have Leah Adams from the Cleveland chapter, and she's going to introduce our speaker. Leah, you can take it away.
Thank you so much, Daphne. Hi, everybody. I'm Leah Adams, and I am the program manager at the National Kidney Foundation serving Northern Ohio office. It's so wonderful to be here today and to educate all of you on your kidneys, kidney health, and kidney disease. The National Kidney Foundation, you're going to learn a little bit about who we are today, but just so you know, the Northern Ohio office covers the 32 county service area within our state. So we have a small but mighty team in this region, but we do a lot of programs like this very frequently throughout the year. And I'm so excited to introduce our speaker for today's program. Her name is Dr. Aparna Padiyar, and she is a nephrologist at University Hospitals Transplant Institute. And Dr. Padiyar has been such a strong advocate in our region, and she truly cares about her patients. She has years of experience being a nephrologist, so she is going to bring you all of the knowledge and education today about your kidneys to be sure that you can leave here today keeping your kidneys healthy. So without further ado, Dr. Padiyar, I will turn it over to you.
Hi, thank you, Leah. That was a very generous introduction. I'm Aparna Padiyar. I've been a nephrologist here in Northeast Ohio for almost 17 years now. And I'm so excited to be joining you tonight. And I get to talk to you about all the good work the National Kidney Foundation is doing and educate us all about a little bit more about what kidneys do for you. So the National Kidney Foundation is a lifeline for people affected by kidney disease. They perform advocacy, education, and accelerate change. And they're a very good resource for our patients with advanced kidney disease. Next slide. And, you know, what do we all know about kidney disease? What do you already know about kidneys? How many of us know what our kidneys do? Can we have a show of hands? How many of you feel comfortable you know what our kidneys do? How many of us know someone with kidney disease? Do you know anyone on dialysis? Do you know anyone who has received a transplant or who has donated a kidney? And kidney disease is incredibly prevalent, and I think through the course of this talk, you'll see that it affects everyone at some point in their lives. Next slide. Some facts to know, just at baseline. 1 in 3 adults are at risk for kidney disease in the United States. 1 in 7 adults have it. But most who have kidney disease, the vast majority, 90%, don't even realize that they have it. Kidney disease is the 9th leading cause of death in the United States. beats prostate or breast cancer. And it is preventable, particularly if caught early. If you catch kidney disease early, there are medications, there are lifestyle choices that can be made that can halt or slow progression. COVID-19 can impact kidney health. It's important to get vaccinated and mask up to protect yourself and loved ones. We'll talk a little bit more about that through the course of the talk. Next slide. So what will we learn today? What the kidneys do and why they're so important. We'll learn about kidney disease, dialysis, and transplant. We'll learn about who is at risk and how to protect your kidneys. And then finally, why you should care and what you can do about the problem. Next slide. So kidneys, they are more important than you'd think. So I think kidneys happen to be really, really important. The biggest thing that kidneys do are they remove waste products and excess fluid. They clean and filter your blood. Toxins and fluid, that's what urine is, okay? But besides that, besides cleaning and filtering your blood, kidneys do a whole lot of other things. They balance minerals, pH, so acid base in the blood, and fluid. They help, by doing this, they help other organs and muscles function properly. They can also keep fluid levels in balance throughout our body. They help keep bones healthy. Kidneys actually are responsible for activating vitamin D, so our bones can repair and rebuild. Kidneys help control blood pressure via regulating salt balance and making a hormone that can help control blood pressure. And then kidneys are responsible for making red blood cells. Kidneys make a hormone that tells your body, your bone marrow, to make red blood cells and reminds it to increase your blood counts. Next slide. So how do the kidneys work? Okay. You know, the first step is the heart pumps blood all throughout the body. And it pumps blood into this big artery called the aorta. And from this artery, blood flows into the kidneys and passes through millions of tiny filtering units called glomerula. Right? And then, you know, these glomerula, these are basically blood vessels, tiny, millions of little tiny blood vessels. This is an enlarged glomerula, these filters. And these filters, these glomerula, they can tell the difference between something you need and something you don't. They filter out the toxins, the waste, and they filter out extra fluid from the blood. And that's what urine is. And when this urine is made, when the toxins and fluid in the urine is made, it's drained through these tubes called ureters into the bladder. And that's when you urinate, you pass water, you go to the bathroom. The cleaned blood from these filters goes back into the circulation through a vein and then back up to the heart to get oxygenated and then pumped out again. Every 30 minutes, this cycle continues and the kidneys filter all the blood in the body to clean it. Next slide. Chronic kidney disease is the progressive loss of these little filters, these little glomerula. And these kidneys are damaged and no longer work as they should. Waste products and fluid may begin to build up in the body. Bone disease, anemia, or other complications can occur. But higher risk than that, higher risk of the waste products and toxins accumulating, or bone disease or anemia developing. Higher risk than progressive kidney disease is the risk of heart attack and stroke. Heart and blood vessel diseases can develop at 6 to 10 times the rate of advanced kidney disease or progression to dialysis. Eventually, kidney failure can lead to death. And so it's very important to be treated early, caught and treated early. Next slide. So are you in the 33%, the 1 out of 3 that's at risk? Are you someone who has diabetes or pre-diabetes? Do you have high blood pressure? Are you over 60? Do you have heart disease or heart failure? Do you have a family member with kidney disease? Are you overweight or obese? If you have one of these risk factors, you could be at risk for chronic kidney disease. National Kidney Foundation has this wonderful risk survey, minuteforyourkidneys.com. You can take the quiz, get personalized results, and get tips for talking to your doctor about chronic kidney disease. I think Leah just put the website in the chat for you. Next slide. The 2 leading causes of kidney disease in the United States are diabetes and high blood pressure. 34 million people in the US have diabetes. It's the leading cause of kidney disease. 1 in 3 adults with diabetes may have kidney disease. 1 in 5 adults with high blood pressure may have kidney disease. It's the second leading cause of kidney failure is high blood pressure. Basically, because these little filters in the kidneys, these little glomeruli are blood vessels, and diabetes and high blood pressure impact blood vessel health. Next slide. COVID is definitely associated with an increased risk for severe infection and complications in people with kidney disease, particularly advanced kidney disease. People on dialysis or kidney transplant patients are at the highest risk. Severe COVID infection can cause acute kidney injury, which is the sudden loss of kidney function. Nearly 1 out of 3 people with hospitalized with COVID have acute kidney injury, and at least 10% need dialysis to help treat it. Most people who develop acute kidney injury recover, but having acute kidney injury can increase lifetime risk of developing chronic kidney disease. So it's important to get vaccinated and to wear masks and try to prevent COVID infection, particularly if you have kidney disease and advanced kidney disease. Next slide. What can I do? All right. It is very important to get tested, to get screened. 90% of people with kidney disease don't know they have it. And kidney disease is not symptomatic. You can lose 90% of your kidney function and not have any symptoms. Blood tests and urine tests are needed to diagnose kidney disease. And blood pressures can help screen for the presence of underlying kidney disease. So getting tested is important, particularly if you are at risk. Next slide. There are so many new medications to treat kidney disease that can halt or stop the progression nowadays. It's incredibly important to get screened and tested, because when caught early, the progression of kidney disease can be halted or stopped. It takes decades in general, particularly with diabetes and hypertension, to cause progressive loss of kidney function that leads to advanced kidney disease. Lifestyle changes, eating right, exercise can help stop or slow the progressions, as well as newer medications that are available. So it's incredibly important to get screened. Stage 1 and stage 2, there are 5 stages of kidney disease, as you can see on this graph in front of us. Stage 1 and stage 2 are earlier stage kidney damage, with either normal kidney function in stage 1 or mild loss of kidney function. and some other type of abnormality, a structural abnormality like multiple cysts and polycystic disease, or urine protein in abnormal levels of urine protein and proteinuric kidney disease that suggest that those filters, those glomerula, are at increased stress. As you progress through kidney disease stages with stage 3A and stage 3B, you have loss of GFR. GFR is the number that tells you how much kidney function you have. As kidney disease gets worse, the GFR number goes down. So stage 3A patients have 45 to 59 of their percent kidney function. Stage 3B, 30 to 44%. And then you get to more advanced stages. Severe loss of kidney function is at stage 4 with 15 to 29%, and stage 5 with kidney failure at less than 15%. Most people in this country start dialysis when kidney function is less than 10 to 15%. Not to help kidney function, but just to keep them alive when the toxins and fluid get to at too high levels to allow them to stay alive. When kidney function's around 20%, people are eligible to get listed for kidney transplant. Next slide. What could happen if kidney disease is not screened for, recognized, and treated? Kidney failure. Kidney failure is known as end-stage kidney disease. It means that the kidneys are too damaged to function properly and can interfere with your ability to live. It happens again when 85 to 90% of the kidney function is gone. And until kidney function gets to this level, it's generally asymptomatic. You can't tell. Why it's very important to get the blood and urine screening. Once kidney function reaches this level, you need dialysis or transplant to keep you alive. Next slide. So kidney replacement, when kidney function is so low that you can't stay alive without kidney replacement, there are different ways to replace kidney function. There's hemodialysis, where a machine outside the body cleans the blood slowly over several hours. This can be done either in a clinic or at home. It's usually done several times a week. People need shunts or as a last resort catheters to get the blood from them through the machine and then back to them again. Peritoneal dialysis is a different type of dialysis where the lining of the abdomen, called the peritoneum, is used as a filter to clean the blood. Here, patients do this at home several times a day or are hooked to a cycler at night. This is every day for 7 days a week to clean their blood through that peritoneal lining to help keep them alive. Kidney transplant is the ideal option, with survival rates that are much better than either hemodialysis or peritoneal dialysis and a much better quality of life. A healthy kidney can come from a living donor or deceased donor and is surgically placed inside the patient. But the patient has to be healthy enough to get through this big surgical procedure and take medications, the immunosuppression that prevents rejection. They also need to have a donor or need to be able to wait on the waiting list, which we'll talk about in a little bit. Next slide. In terms of organ donation and transplant, there are nearly 100,000 people who are waiting for a kidney transplant in the US. And nearly 4,000 people died waiting for a kidney in 2019. The wait list is, depending on the area you're living in, it could be somewhere on the average of 3 to 5 years. And that's a long time to wait if you're on dialysis. Around 23,000 people received a transplant in 2019, but over 40,000 people were added. So there's an ongoing need. There's an ongoing epidemic of chronic kidney disease. And just a shortage of organs. Next paragraph. Sorry, next slide. The other thing that people may not be aware of is kidney disease disproportionately impacts some groups. Minorities, such as African Americans, who make up about 13% of the population, but 35% of the people with kidney failure in the US. Hispanic and Latino Americans. Since 2000, the number of Hispanics with kidney failure has increased by more than 70% in the United States. American Indians and Asian and Pacific Islanders are disproportionately affected by chronic kidney disease as well. Next paragraph. Next slide, I should say. You know, and there are a lot of determinants of health and wellness that are outside of our ability to impact. 40% of health behaviors 40% of what we can impact are health behaviors. So diet, exercise, alcohol, and tobacco use. And 10% is the access and quality of the healthcare we receive that impacts our overall health. But half of our overall health is mediated by genetics and social determinants. So 30% genetics, 20% social and environmental factors. Things like education, your job status, whether you're employed or not, family and social support, income, community safety, the quality of the neighborhood air and water, whether or not there are environmental toxins in your neighborhood, mass incarceration, racism, discrimination. Simple things like, do you have access to neighborhoods that are safe to walk in? Can you get exercise in those neighborhoods? Do you have access to food that's healthy? What is the level of food security? Can determine health and wellness. And patients with chronic kidney disease are disproportionately affected by these adverse social determinants. Next slide. So again, social determinants of health and their impact on kidney health. Income. Research shows that a household living at or below federal poverty line can increase your risk for CKD by as much as 60% compared to wealthier households. Food insecurity and food access. People with food insecurity are more likely to be overweight and obese, which increases the risk for things like diabetes and hypertension. Chronic kidney disease is more common among people who are food insecure. And people in lower income areas have fewer supermarkets at low cost or low cost grocery options. They have more convenience stores and fast foods which are associated with increased risk of chronic kidney disease. And again, this idea of access to recreation and exercise. What does your neighborhood look like? Low income neighborhoods with larger populations of people with who are minorities have fewer recreational facilities. One study found they're 4.5 times more likely to not have facilities in high income areas, and this provides barriers to exercise and healthy living, which impacts development of chronic kidney disease. Next slide. So what can we do? What can we all do? 1, 2, 3, get tested. Have your friends get tested. Make sure people are screened, particularly if you are at risk. The next thing you can do, control your risk. Keep your blood sugar and blood pressure under control. Eat right, exercise, watch the salt in your diet. It's not only progressive kidney disease that you're trying to avoid, it's the cardiovascular risk of heart attack and stroke. Again, that risk is 6 to 10 times higher than the risk of progressive kidney disease. So eating diet rich in fruits and vegetables, limiting processed foods, trying to limit the sodium in the diet, considering a DASH diet or a Mediterranean diet. Get moving, exercise. Physical activity has many health benefits. Aim for 150 minutes a week of moderate to vigorous activity. It's as important as brushing your teeth, and it should be a priority every day to fit in exercise. Number 5, quit smoking. This is not an easy step, but an important one. I would argue all of these are not necessarily easy, but choices we make on a day-to-day basis. There are many smoking cessation resources available. You don't have to do it alone, and it can dramatically add years to your life. And then caution with pain medications. NSAIDs like aspirin, ibuprofen, naproxen can be kidney toxic. So Tylenol over the counter is safe for kidneys, and the dose is recommended, especially with taking it with not avoiding alcohol when taking it. But these other pain medications can be kidney toxic, particularly if used in a long-term daily fashion. Next slide. So National Kidney Foundation is amazing with resources to help with healthy eating. You can look on their website. They have a lot of educational books and resources. But this is something that all of us need to be doing better. Fill your plate with fruits and vegetables, at least half. Aim for half your grains as whole grains. Move to low fat or fat-free dairy source and varied types of protein. Drink such that your urine is clear. Watch portion sizes and limit saturated fat, sodium, and added sugar. Aim for low processed or non-processed foods. The healthiest diet is generally a plant-based protein diet. And physical activity, again, very important, vitally important. Aim for at least 150 minutes each week of physical activity. Find something you love doing and keep doing it. Walking, biking, swimming, golfing, gardening, dancing. Find a friend. You're more likely to participate and keep to it if you have a friend that's doing it. And don't get discouraged. If it's not 150 minutes a week, work up to 150 minutes a week. Any little bit helps. And as you get older, particularly as you get older, you always want to be working to stronger and better. That's life. That's what you want to be keeping on doing. Otherwise, life catches up with you, right? So make sure doing at least 10 minutes of activity at a time for added health benefits. Think about what are ways that you can add movement to your day. It can be as little as 20 minutes a day. Okay. You're not alone. There are a lot of programs that can help. National Diabetes Prevention Program, Chronic Disease Self-Management Program, Diabetes Self-Management Education and Support, Smoking Cessation Resources. There's a lot of help out there. All right. All right, who's ready for a pop quiz? How many people in the US have kidney disease? Does anyone remember?
That's a tough question. Sherry said 36%.
It's 34 million. It was in
Ooh, 34 million. Wow.
Yeah. Next.
37, Dr.
Sorry,
P. 37
There
million.
you go. Leah's keeping me at 37 million. Next one. What are the 2 leading causes of kidney failure?
Diabetes and
Diabetes, hypertension.
There you go. Yes. Who can name some other risk factors for chronic kidney disease?
obesity,
Your race.
Family, genetic.
Yeah.
smoking,
Yes. Good.
Sedentary lifestyle.
Family history.
3.
You're right.
Yep.
Why is early detection important?
because it can stop the
Progression.
progression or deterioration of your kidney decline of function.
And you
Exactly right. Yeah, diet, exercise, lifestyle modification, their medications. There's a lot of ways to slow down, and the earlier you find it, the better impact you can have. What are some of the things that you can do to keep your kidneys healthy?
exercise, eat right.
Yeah,
Maintain a good blood pressure.
Keep diabetes under control. Very good. Keep yourself hydrated.
Follow up with your doctor every year or more.
37 million Americans, 9 out of 10 don't know it. Yep. I think we got all of these. Are you in the 33%? Minuteforyourkidneys.com is a great screening tool. Help people understand how at risk they are and understand the need to get screened.
Should this be part of your regular screening though, when you go to see your doctor? Like, how do you encourage them to screen you?
That's a good question. You have that conversation with them. You bring it up to them. Honestly, kidney disease does not have the PR that heart disease or things like prostate cancer and breast cancer have. People are that it may not be talked about as much, and it may not be screened for as effectively. You know, only even diabetics who are at high risk of kidney disease, only 25% are getting the adequate screening that they need to be getting in terms of the blood and urine tests. A lot of PCPs even can miss the urine test because they're thinking about treating the high blood pressure and treating the diabetes and treating the 20 million other things that they're dealing with in the PCP's office. So it may not get screened for adequately. So it's important to be vocal and have that conversation, particularly if you're at risk with your primary care physician.
Okay. Thank you.
you talked about medications and declining kidney function and how they can affect the kidneys. And you mentioned aspirin being one of them. A lot of older people, especially if they have diseases like heart disease, they're on baby aspirin daily.
So that's fine for heart disease and such. Aspirin it is not necessarily considered kidney toxic. It's more of those over-the-counter pain, other non-steroidal anti-inflammatories that you're taking for pain management. So Motrin, Advil, Aleve, ibuprofen, Excedrin, those type of medications, and particularly taking them for a long time. A baby aspirin or even a full dose aspirin under doctor's orders for heart disease prevention or treatment is okay.
Thank you.
And then for people with joint, a lot of them take meloxicam. With joint issues, they have to be mindful of that as well. Celebrex, if that's still out, I don't know.
Yeah.
And all of those other, they can be kidney toxic. Meloxicam, Celebrex, they're very effective for pain management. They're very good for pain management, but they are definitely kidney toxic.
Right.
Right. Well, Dr. Padiyar, you did such a good job, and you did that in, I think, record timing. I've never seen somebody do your kidneys in you that fast. That was amazing, short and sweet to the point. But yeah, I just wanted to kind of end our presentation today sharing a little bit about some of the NKF national resources that we have for all of you. But also, if you're listening and you know somebody in your life that has kidney disease, is at risk, maybe they're on dialysis, they're waiting for a transplant, they're considering a transplant. These are really great resources that our National Kidney Foundation offers. So I just kind of wanted to quickly run through them. Our NKF Cares program that we have up here on the slide, this is our toll-free hotline program where people can call into the number up on the screen or shoot an email to this email. And on the reciprocating end of the emailer number is a trained kidney health specialist who is able to answer any questions a individual may have about kidneys, kidney health, and kidney disease. What's also really nice about this resource that some people on this call may appreciate is that you can remain anonymous. So you do not have to disclose any information. If you just kind of want, certain questions asked and you don't feel comfortable disclosing a lot of who you are, that is totally fine. That trained kidney health specialist just gives you the information you'll need. The second resource that we have is our NKF Peers program, and this is our peer mentorship program. This is for people that are already kidney patients and they are potentially newly diagnosed, or they're just starting dialysis, or they're seeking out a transplant, and they feel very alone in their journey. And so the beauty of NKF Peers is to make people feel like they're not alone. So they have a buddy and they have social support, and NKF does a really good job with strategically placing somebody with another individual that is similar to them, right? So it could either be similar gender, age, stage of diagnosis, potentially geographic location. There's a bunch of variables to it, but it has been such a wonderful resource for patients. And then finally, we have our online communities, and these have been booming during the last year with COVID and the pandemic, and really kind of being in this virtual world that we're still, living in and still doing, like we are here today. And our online communities are monitored by NKF staff members, so it's not like a free for all and people are just posting things. People kind of share blog posts, questions, are seeking out guidance, advice, and again, NKF staff is monitoring it, so making sure that it's all factual information, people are being, appropriate with each other and all that kind of stuff. But it's really been cool to see. I've heard some people that have connected in different states, and one part of the country versus all the other way on the other side of the country, and become friends, through these online communities, which is really special. Another thing, if anybody is interested in, is our advocacy program. Is somebody wanting to ask a question? I'm hearing some background noise. I didn't. No? Okay. The advocacy is a huge thing, and actually Dr. Patty Yar mentioned this in the beginning of the program, that National Kidney Foundation does a lot of work both locally and nationally to try to pass bills and laws to protect our kidney patient community. We've done a lot in the state of Ohio, and then we are also working on a federal national level as well. Every single year, the NKF tries to find advocates to testify on Capitol Hill in front of our lawmakers for Congress, and try to increase research funding for kidney disease, expand kidney patient access to home dialysis. That's something we're working on. Extending Medicare's immunosuppressive drug coverage from 3 years to lifelong. Dr. Patty Yar talked a little bit about this, that once somebody receives a kidney transplant, they need to be on immunosuppressive drugs. And unfortunately, insurance kind of gives some patients difficulties with that, right? So you don't just need that for 3 years, you need that, for your life. So, and another thing that Ohio has been very successful in has been passing the Living Donor Protection Act, which this is very interesting when I first started working here and learning about this. But historically, life insurance companies have been discriminating individuals that were seen as a living kidney donor, because they were seen as a risk because they only had one kidney, which is crazy, right? You shouldn't be discriminated against because you just have one kidney, because just educating everybody here that you can live a healthy life with just one healthy kidney. And I know so many living kidney donors that are healthy and are living their best life. So these are just a few of the things that we're working on to try to expand more awareness and education for our kidney patient community. So if you're interested in getting more involved, you can visit that website up on the screen. Another thing I wanted to share is that next month we are having a patient symposium, which is a program that I'm actually putting on as well. And this is our largest patient and caregiver event for kidney patients and their caregivers. It is going to be a 4-day hybrid event. So 3 days virtual, 1 day all in person. The in-person is going to be in Independence, Ohio, on Rockside Road at the Holiday Inn South. And it is just a time for people to become educated engaged and empowered in their kidney journey. We are having people that are all stages of kidney disease. We're even having some people attend that are at risk for kidney disease. We're going to have a free lunch, free giveaways, and it's just an amazing time. And we've been doing this for 8 years, and this will be our 9th year doing this patient program. And it is free to sign up. So if you have your smartphone, if you want to scan that QR code, it leads directly to our patient symposium website. And that's kind of everything I have for all of you. Again, minuteforyourkidneys.com. As Dr. Padiyar said, one of the biggest things that you can do to become your own best advocate is to make sure that you're doing everything in your control, right? And one of those things is seeing if you have risk factors for chronic kidney disease. And that quiz, minuteforyourkidneys.com, can assess if you are at risk for kidney disease. And then you can also learn how you can help kidney patients across the country, and kidney.org/take action is another part of our advocacy program. So I just wanted to, again, thank everybody for taking the time out of their Sunday evening, but I guess we'll pause here to see if there's any other questions for Dr. Padiyar from today's program.
I have a question. So during your lecture or your presentation, you mentioned a lot of medications that I'm actually still taking. What are some things that I can do or I can be aware of, or tools that I can use to see what the ramifications of certain medications could have on my health as it relates to kidney disease? Because the doctor actually never did tell me that. One of the effects, so I think Cymbalta was mentioned. Or Celebrex, I'm sorry. Celebrex was mentioned. I take that, and another doctor told me it can cause ulcers, but no one mentioned kidney disease. What should I know? What should I be asking?
Yeah, I mean, it can be really difficult when kidney function gets to less than 45%. Medications need to be dose adjusted, or certain medications need to be changed, or particularly when kidney function is really low, less than 30%. And that can affect things like diabetic medications and insulin clearance and such when kidney function gets that low. Usually, kidney doctors nephrologists take care of people when the kidney function is less than 45%. And usually part of what a nephrologist does is look at where kidney function is, get blood and urine tests once every 3 to 4 months for these patients, and then also review the medication and dose adjust medication. For people who have higher kidney function, or who have risk for kidney disease, or who have kidney disease, who are not seeing a kidney doctor, pharmacists can be really good resources when you're getting a new medication, or getting an over-the-counter medication, because there are a lot of different medications that you don't necessarily want to take. Besides non-steroidal anti-inflammatories that we always think about, you may not want to take decongestants that can drive up blood pressure. You may not want to take many herbal medications have just not even been studied in people with kidney disease. So you may not want to be taking those medications. It would always be advisable to review medications with the pharmacist or with your primary care provider, specifically asking the question, I have advanced kidney disease, or I have kidney disease, or I have risk for kidney disease. Is this medication okay to take? I mean, kidney disease takes, in general, if people are not sick and they're asymptomatic, kidney disease takes decades. And so you always want to understand the risk versus benefit of taking new medications over a long period of time. And so having those conversations with your doctor, making sure they're aware of all the different medications that you're taking, the over-the-counter ones, the herbal ones and such, and making sure that it's okay with where your kidney function is. Pharmacists as well, it can be a really good resource, because it can be difficult to have that conversation in the context of 20 million other things in your primary care doctor's office. But a pharmacist will be trained to pick up these to educate you on the side effects and particularly kidney related dose adjustments and kidney related risks.
Thank you. I do see that pharmacists are underused as a resource, so thank you for mentioning that.
Also, doctor, would you recommend that when you go to see your primary care doctor that they check your blood once or twice a year if you're on those medications, your chemistry panels?
Yeah, I mean, depending on where your kidney function is and where your risks are, the kidney, like our kidney society, the KDIGO has specific guidelines as to where your risk is, where your kidney function is, how many times a year you need to get screened. So that can be anywhere from twice a year to 4 times a year, depending on where your risk is. And that screening usually is blood and urine screening. So it's important to have those conversations just to even know how often you need to be screened. And as soon as there is any issue, taking you off of those medications or simplifying medications.
I know this is Sister Circle, but sometimes we have men who often will view our videos as well. So I want to address the fact that some of the men do not like to take the medication because of some of the common side effects. So can you review those and also talk about, again, review some of the issues or the consequences of not taking the medication?
Yeah, it's really important with kidney disease, the biggest risk is of heart attack and stroke. Most people don't reach dialysis. Most people succumb to the heart attack or stroke first. It's 6 to 10 times higher than the risk of progressive kidney disease is the risk of heart attack or stroke. It's really important to take the blood pressure medications and the SGLT2s, to take the medications as prescribed by your doctors, not only to decrease your risk of progressive kidney disease, because your parts will age with you. You will have decline in kidney function over time. You want to try to limit that decline to what is age appropriate as much as possible, and to give yourself reserve. And all of this is asymptomatic. You're not going to be able to tell the difference right away. But you want to prevent that heart attack. You want to prevent that stroke. You want to live longer. You know, this is not about immediate results. You may not see this in a number or in your labs immediately. This is about you living to be able to dance with your kids at their grandkids at their weddings, right? This is something that happens over decades. So this is about adding years to the end of your life, adding quality years to the end of your life. If you're having side effects, have that discussion with your primary. There are hundreds of different medications to try, and there are ways to help. They don't the doctors, your doctors don't want to make you suffer with these medications. They want to do what's best for you, what's best by you. But it's worth having those discussions, because everything is going to be risk benefit. Everything is going to be, it's life. It's a conversation about what you want to get out of it, how the risk versus benefit.
Absolutely. So again, they call it the silent killer for a reason, because some of us walk around with high blood pressure, or we feel okay, even though we don't want to take the medication. By the time you have symptoms, that means that it's that happen over the time.
And you don't want to wait for symptoms. And like this is hard. This is not stuff that people do because they want to. This is not stuff that people do automatically. You know, once or twice daily dosing of medications, you forget, you don't plan ahead, you you want to just live a normal life without medications. It's costly. It's a pain in the butt to go to to call the doctor's office to make sure you have a refill. It's a pain in the butt to go to the pharmacy and get the refill. But again, you're adding years to the end that you want to be dancing with your grandkids at their weddings. You have to keep you have to keep your eye on the prize. What's important in your life, right? I mean, I love my kids more than life itself, and I've forgotten to give them doses of antibiotics over a 2-week course. There was a study years ago, a physician health survey, 10 years, one medication, placebo versus aspirin. And these are all a group of physicians, 10,000 physicians. All they had to do was take one med daily for 10 years to try, and the study was to see whether or not the medication, the aspirin versus placebo, would prevent heart attack. Can you guess how many people were able to do it? How many of these educated physicians, who you can't get much more educated than those physicians about how important it is to take their meds?
About 25%.
I was about to say, because we're the worst patients.
I-
Well, yeah, you guys know doctors, right?
Right, right.
About a third of and these are the people that admitted that they weren't compliant.
Mhm.
So about a third of them were able to
Right.
do it consistently. It's
Wow.
hard. It's hard. You have to, the people that do this the best look at it almost in a religious manner. That it's something that they just have to do. But you have to believe that it's going to add years to the end of your life. You have to understand why you're doing it, what's your motivation for doing it. And so admitting it's hard, making it a priority, making yourself a priority, having a partner to help you. If you have a husband or a wife or a partner of some kind that's helping you, multiple medications can be.
Oh. Ah.
Dr. Patty, she
Oh,
froze.
no.
I
Yeah,
could
she
say
froze.
a resource for
no.
my sister Keeper Cleveland, that if you need that resource of someone to go to the hospital with you or to your doctor's appointment with you, you have that resource where you can have one of a companion go with you to the appointment, so that if you need that support, we're there to help you with that support. So that's another resource for our sisters to have that support if that's the need.
Yeah.
Go, Patty, are you just finished what you were saying?
No, I think you said that very well. No, the support is very important. Friends are good, connections are good. You all know this.
Any other questions or comments? Right. Well, Daphne, I will let you take over and close us out.
Okay. All right. So I want to thank our presenter, Dr. Patty R. Your information or your presentation was quite informative. I even learned something as a healthcare provider myself. So as a nurse, doesn't mean we always know everything. So I actually learned a few things today myself. Also, I would like to thank Leah Adams, who is part of our partnership with National Kidney Foundation. Thank you so much for helping us to get this information out. I also want to thank our local partner, My Sister's Keeper, for being the avenue in which we were presenting today's presentation. We were just saying how Cleveland, we have so many organizations here, and really great organizations, and we should really partner more with each other. So we definitely thank the National Kidney Foundation and My Sister's Keeper. But most importantly, I want to thank our guests. I really want to thank you for taking time out of your Sunday. We hope that you would walk away with some increase in knowledge or some new information that's going to help you to positively impact your kidney health. So once again, thank you everybody, and have a great afternoon or evening, however you see it.
And a lot of times, often, our My Sister's Keeper community, if they don't watch right away, they often will see the playback. That's why we upload our videos. So if you don't watch today or tomorrow, the video will be available so that you can access it and share with other people as well. Thank you all so much.
Thank you, everybody.
Goodbye.
Have a good night.
Bye.
Thank you.
Thank
Have a
you.
good evening.